So we'll say you are dispatched for a report of a person that is having difficulty breathing. Police and fire units on the scene. Upon your arrival, they direct you to the back deck where you find this young lady having shortness of breath. So the first thing you want to do, scene safety BSI for me and my partner. Is everybody safe? Even though the cops are there, you still want to say it. So I have scene safety BSI. I then watch as I'm walking in. I'm checking, watching the patient, seeing if she interacts with me as I walk in. Is she tracking me? Is she following what I'm doing? Hi, I'm Charles. I'm with the ambulance squad. You notice I lower myself to the level. I'm automatically checking for her pulse. Hopefully she talks to me. What kind of airway does she have? Does she speak in full sentences? Does she speak in only 1 to 2 words per sentence? Is there any hint of stridor that you hear? All these audio things you want to listen for. So she's alert and oriented. She's talking, we'll say a couple words per minute. All right, she has a good pulse. So I know she has a patent airway because she's talking to me because she wouldn't have it otherwise. I know she has a pulse because she couldn't talk without a pulse, and I'm feeling it. I don't know the numbers yet because I didn't get that deep into it. What seems to be going on? I asked her exactly. I was working in the yard and now I'm suddenly having difficulty breathing. Okay, so now she's telling me exactly what happened. So now she's ANO times 4 because she's person, place, and event. So she knows that. All right, so she's having difficulty breathing. I want to look at that. I want to see what's really going on. I want to actually listen to lung sounds. I want to just do a quick lung sounds. I want to look in her mouth. I don't look in the mouth. Anna likes to look in the mouth. For an adult patient, there is no reason to look in the mouth because you're not going to see what you're going to see for a kid. That's actually in the documentation in the book. So what I want to do is I want to actually listen to lung sound. Boom, 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 or an axillary to see if there's lung sounds. Hey, there's wheezing. All right, so now in the back of my head, there's wheezing. Let's put her on high flow too. We'll get back to the rest of it afterwards. So now we know she has a patent airway. We know she has breathing at, we'll say 22, rapid and shallow. So we put on high flow too. We started our treatment mobility. So now what we're going to do is want to check for a pulse. Okay, she has a pulse of 120. You know, it's strong. Is it strong, fast, or slow? We'll say strong right now. All right. So now I want to look at her skin condition, temperature and condition. So if I look at her, she has hives all over the place. What's hives represent? Probably allergic reaction to something. So now I'm going to put that. Do I want to stay and play with her on the scene, or do I want to load and go and get her to the hospital? Obviously, she's having shortness of breath. She's having probably an allergic reaction to something. Probably the best bet is to get her to the ER. Have ALS dispatched as well. So now you were off scene. That took me a whole 2 minutes to say I'm getting off scene. So now before I want to go, I want to go ahead and get a sample history. So sample, what does sample stand for? S.
Signs.
Signs and symptoms. Basically, the signs and symptoms is what she's telling you, what you see. I can see that she has hives. She's telling me she has difficulty breathing. That's your signs and symptoms. Okay. Allergies. What's your allergy? Oh, I'm allergic to bees and penicillin. Oh, what were you doing? Is all some medications. She has an auto injector, epi injector. So she has an EpiPen. Allergic or past medical condition is hypertension with allergic reaction to bees. Last oral intake, breakfast is now lunchtime. Events leading up to what happened, she was out in the yard working in the garden. So this is my sample history. OPQRST, onset, how long did it start? We'll say 15 minutes ago. Paid provocations, what makes it better, what makes it worse? Does anything she do makes this condition worsen or better? We'll say nothing makes it better, everything makes it worse. That's usually the standard thing that we say. Provocations, OPQR, does it radiate anywhere? Obviously she's having difficulty breathing. How's it going to radiate anyway? But you want to ask us, hey, do you have any other pain or any other discomfort that's going on with this? No, just difficulty breathing. All right. OPQRST, time, right?
S, severity.
Severity, I'm sorry. Severity. From 1 being very little discomfort or difficulty breathing to 10 being the worst discomfort she ever had. what do you rate that? She'll, it's probably a 7 out of a 10. Sometimes people say it's a 12 out of 10. So you have to ask these questions. Then I always ask stupid questions of why'd you wait so long to call me? So severity, OPQRST, time, how long has it been? 15 minutes. Interventions, have you done anything to help yourself before calling me? No, I didn't. I just called 911. All right, like I said, a lot of people won't give themselves an EpiPen because of the size of the needle. The needle is huge. I know I won't. That's a big needle going into you. So that's why a lot of times they don't. So before I do that, I already have in back of my mind I want to do the EpiPen or a EpiPen on my truck. It doesn't matter which one I'm going to give. But what do I want to do? I want to do a good set of vital signs because I can't give a medication without getting a good set of vital signs. Vital signs, I want to have respirations. I want to have a good pulse. I want to have a good blood pressure, top number and bottom number. I also want to make sure I have good lung sounds. I want to make sure I listen to all 6 quadrants in the back, all 6 spots in the back, the 4 spots in the front. I also want to look at the chest, right, and her neck to see if she's using any exterior muscles. Meaning if she is really in distress of breathing, these muscles would be flaring out. They'll be popping out at you going, holy shit, it's amazing. Also, I have on her non-rebreather, so I want to see if that bag valve, the bag on the non-rebreather is actually working. Because that will, if she's really in distress and she's taking deep breaths in, she will suck that bag dry, and then it'll refill, and it'll suck it back. And that's actually the proper way of using a non-rebreather. So I want to make sure all these things are falling into place. Now I want to go ahead and get an EpiPen. If it's her EpiPen or if it's my EpiPen, it doesn't matter. But if it's her EpiPen, I want to make sure that I have the 6 patient rights. Right patient, right dose, right route, right expiration date, documentation, and there's one more. Dose there, I said, but you get 5, huh? I know there's 5, but all right. But if you miss one of those during your assessment, during the exam, don't worry about it. If you get most of them, they're going to give you the point anyways. Don't worry about it. As long as you get the right dose, or right patient, right expiration, and right route. Because obviously you're not going to put an EpiPen up here. You're going you want to go intermuscle into your thigh. So now I want to go ahead and give the EpiPen. Or I want to say this is a medical control. I can call it medical control, or this is a standing order. Remember, if you say standing order, think about, you need to know the standing order, because you open yourself up for those questions where I, as an examiner, can say, oh, it's a standing order. Tell me the contraindications of it. Tell me the indications of it. And so you have to know the standing order. Or just say, hey, I know it's a standing order, but I also will call medical control if I have any questions on the order to make sure that I'm 100%. Because now you just cover yourself. Okay, if I'm not sure of it, I'll call medical control. Pretty broad answer. So then I want to go ahead and give the medication. I want to actually hit her in the thigh with it. Hold it for 10 seconds. Let all the medication go in. I want to rub it in, make sure it goes in. I want to dispose of the needle properly so it doesn't jab me later on during the call. Now we're on our way to the hospital. I also want to do a reassessment.